So a career in public health looks like preventing disease before it begins. So in my own life, I come from a first-generation family right here in the Clear Lake, Webster area. And so noticing folks around me, family members, friends who would often get sick from chronic conditions like diabetes, for example, inspired me to want to work to prevent these diseases from starting in the first place. So we can do this through a number of ways. We can do it through creating effective government policies. I've worked with Harris County Public Health to really work at that high level to stop that. And so these sorts of experiences, personal and professional, really inspired me to pursue a career in public health. And a lot of our work focused on food insecurity. So food insecurity is defined as a family not having adequate health for themselves or their family for a given period of time. So one project I did was working with a clinic up in Baltimore, Maryland. And what we sought to do was see, could we predict food insecurity in the clinic? In other words, are there ways we can see if there's a high likelihood they're food insecure based on their social circumstance? We can work to prevent it and stop negative health outcomes from stemming from that. So a lot of my work in the front lines, again, focuses on using data science technology, machine learning, public health, and social policy to create change. It's a really interdisciplinary topic that I love to focus on. So I'm a first-generation student. I'd be the first in my family to go to medical school eventually. My family has been integral to shaping where I am now. I'm Iranian American, and so a big part of our culture is giving back and supporting the community. So really that perspective from my family has shaped how I view big problems in healthcare and policy and in data science. I chose UH because I wanted to be near my family. And also, UH is right by the Texas Medical Center, which is the largest medical complex in the world. And so being at UH is a really natural transition for me to be close to this center. I've definitely faced struggles discovering my passion. The healthcare field is a challenging one, and I'm sure many of you recognize it's hard sometimes to find a doctor to work with, or when you go into college to get into research opportunities, gaining the skills like in computer science and data science, and I experienced those too. Financial aid is a really big barrier and access point for those who want to go to college. College is expensive. And for me personally, I found it difficult to afford college. And so I would recommend as many of you to look into scholarships and financial aid. There's a wealth of information available. I remember when I was a student, I used Naviance. I'm sure many of you are familiar with them. I got a couple scholarships from that. Really finding where the opportunities and resources are, and your teachers can help you with this. Planning ahead is so helpful, and being intentional about which opportunities you pursue will be really helpful. You don't need to have everything figured out, but try to find ways that will help it be easier to reach the goals and the things that you know you like to do, whether that be acting, healthcare, everything is possible. Host is a club right here on the Clearbrook campus. Mrs. Angela Vong and Mrs. Zenia Ridley run it. I'm sure many of you are familiar with them. When I came into Clearbrook, I didn't really know what I wanted to do in the future or how to expose myself to leadership opportunities. So I joined my first HOSA meeting, like I sat in the back, didn't talk, do anything. And then over time, I saw myself coming near the front through leadership, through service opportunities. It was an amazing organization in that regard. Really being in that organization, getting leadership opportunities, service opportunities, chance to change health outcomes at a conference or in our own school at Clearbrook really inspires the way I view health, and HOSA is very important for me.